Picture this. You're just about to take the first bite of your absolute favorite meal. You've been waiting for this all day. You lean in, you take that bite, and bam. A sudden, sharp, shooting pain just ruins everything. Yep, it's the dreaded mouth ulcer. I mean, it's just bizarre, isn't it? This tiny little crater of misery, often no bigger than a grain of rice, has the power to make eating, drinking, and even talking feel like a form of torture. So how on earth can something so minuscule pack such a powerful, painful punch? Okay, let's get into it. To really get why it hurts so much, you gotta think of the lining of your mouth, your oral mucosa, as the protective wall of a castle. Well, a mouth ulcer is a literal hole in that wall. It's a breach that leaves all the super sensitive nerve endings underneath completely exposed to, well, everything that comes into your mouth. And if you get a chance to look at one up close, you'll see it's telling a story. You see that whitish center? That's not the bad guy. It's actually a biological bandage made of a protein called fibrin, and it's trying its best to cover the wound. That angry red ring around it, that's pure inflammation. It's your immune system rushing to the scene to fight off any potential invaders and start the repair process. So the pain you feel, it's this nasty 1-2 punch of raw exposed nerves and your own immune system going into overdrive. So why does that castle wall get breached in the first place? It's usually not just random bad luck. There are some very specific triggers, and we're about to launch a full-on investigation into the 4 main culprits. Let's line up the usual suspects. Our investigation is going to focus on 4 key areas. We've got straightforward physical trauma, a very surprising chemical culprit that you might be using every single day, some hidden gaps in your nutrition, and finally that powerful, powerful link between your mind and your mouth. First up, the most obvious one, physical trauma. Look, we've all been there. You accidentally chomp on your cheek, you get a little too aggressive with your toothbrush, or you scrape the inside of your mouth on a sharp tortilla chip. Ouch. But for people who get ulcers all the time, their immune system tends to overreact to even a teeny tiny scratch, blowing it up into a massive, painful ulcer instead of just healing it quietly. But what if you haven't bitten your cheek? What if you've been super careful? Well, our next suspect might be the most shocking one of all, because it could be hiding in plain sight, right there in your bathroom. All right, I want you to go look at the ingredients on your toothpaste tube. There's a really good chance you're going to see something called sodium lauryl sulfate, or just SLS. So what is it? Well, it's a detergent. Its only job is to create that foamy feeling we've all been taught means clean. But the thing is, SLS can be pretty harsh, and it can actually strip away the protective mucus layer inside your mouth, leaving the tissue underneath dry, irritated, and really vulnerable to damage. And this is where it gets crazy. The impact of this one ingredient is stunning. For people who get ulcers over and over again, scientific studies have shown that just switching to an SLS-free toothpaste can slash the number of outbreaks by up to 80%. Let that sink in, 80%. That is a massive, massive difference from one tiny change. Okay, so our third suspect takes us a little deeper, inside the body itself. Think of your mouth as a high-speed construction zone. The cells in there regenerate incredibly fast. But to build strong new tissue, your body needs a constant supply of raw materials. You know, the right bricks for the job. And when you're running low on key nutrients like B12, iron, folate, or zinc, your body just can't build that protective wall properly. Because that tissue turns over so incredibly fast, the mouth is often one of the very first places these nutritional gaps start to show up as a real problem. And finally, we have the suspect that explains why you always seem to get an ulcer during finals week or right before a big work deadline. When you're under chronic stress, your body gets flooded with the hormone cortisol. Now, high levels of cortisol actually suppress parts of your immune system, basically telling your body's repair crews to, take a break. So a tiny micro-injury that your body would normally fix in minutes is instead left wide open and allowed to fester into a full-blown ulcer. So now that we've unmasked the suspects, what's our counterattack? Let's put together a real, actionable battle plan for both preventing these things and for getting some immediate relief. Okay, your 4-point prevention plan is pretty simple. First up, the chemical detox. Try an SLS-free toothpaste just for a month. See what happens. Second, fortify your foundation. Make sure your diet is packed with those nutrients we talked about. Third, just be gentle. Use a soft bristle toothbrush. And fourth, you gotta manage that stress. Prioritizing sleep and hydration is absolutely crucial for your body's repair cycles. But what if you're in pain right now? I mean, prevention is great for the future, but you need help like yesterday. So let's cover the essential do's and don'ts for dealing with an ulcer you already have. All right, first, what not to do. Please, whatever you do not rub salt directly on it. That's just torture, and it doesn't help. Also, avoid alcohol-based mouthwash. It just dries everything out. And it probably goes without saying, but steer clear of acidic or spicy foods. Now, what you should do. Gentle, warm saltwater rinses to keep the area clean. Use those over-the-counter gels or patches to form a protective shield over it. And hey, there's no shame in using numbing agents for some temporary relief so you can actually eat a meal in peace. Now, before we finish up, we really have to talk about something serious. Look, 99% of the time, a mouth ulcer is just a painful nuisance. But very rarely, a sore in your mouth can be a red flag for something more serious. Here is the single most important rule you need to walk away with today. If you have any sore anywhere in your mouth that has not healed after 3 weeks, you absolutely must get it checked by a doctor or a dentist. No excuses, no exceptions. Just burn that number into your brain. 3 weeks. A normal ulcer will go through its healing cycle and disappear. A lesion that sticks around and doesn't heal needs to be investigated by a professional because it can be a sign of more serious conditions. And a few other red flags that mean it's time to see a doctor include an ulcer that's unusually large, say bigger than a centimeter, or if you get them so often that your mouth is never actually clear. Also, if they show up with other symptoms like a high fever, joint pain, or rashes, that could be a sign of an underlying autoimmune issue that needs attention. So, while most of these ulcers are just a temporary, painful problem, the good news is you now have a real plan to fight back. And it might just start with the easiest and maybe the most impactful step you can take today. This one simple question could be your first move in reclaiming your mouth from these tiny, tiny tyrants.